Hi folks, this is Saryam for CBNR. Um, in the earlier video, we were talking about how the pain is an important function of survival and the value of those things in evolution and things like that. So what I thought today I will do is I will expand on those because a lot of people were like, where are you going with this story? What are you trying to say with this story? So I thought I will expand on those things first with some amount of physiology so that we have a far better understanding of pain, right? So I'm going to talk about the definition first. As you all know that nowadays the pain is defined as a sort of a sensory as well as an emotional experience, right? So this is a very valuable part of the definition, especially that's what I think. It gives you so much of information in which direction you need to move when you're studying pain or when you're a practitioner of pain relief or pain management and things like that. And the other part is also the important thing, that is the actual or potential damage, right? We know that it is not just because of your actual damage. If you have potential damage also, you may have sensory and the emotional experience of pain also. You can get that also. Now in this video I'm trying to as I told you expand on these two parts, that is the sensory and the emotional part of the experience. Right. So in the last episode, I said that somebody gets a snake bite and they are sort of shouting in pain, right? That is basically this. That is, they had a sensory experience because they know where the bite is, right? They know where they had where the snake touched it, where the snake gave them a chemical insight and things like that. And also they had an emotional experience. What do I mean by emotional experience? In that example, remember the person is they come and tell him that you had a snake bite by seeing the bite, right? They have said that you have a snake bite. So what does that guy do? He's immediately thinking of dying, that kind of emotional experience, right? And there are a lot of other things happening, right? He stores these things, this emotional experience in your brain, probably via your hippocampus. From the hippocampus it goes into your neocortex or your cortex, right? So these kind of things are what actually happens to us, right? So I think this newer definition encapsulate those things. That's why I was talking about that story, to make us understand that it is a sensory as well as an emotional experience of a actual or a potential tissue damage. So that's the next thing we want to understand. When will I say that this is pain, or I'm having a painful experience, or I'm saying that I'm in suffering from pain? Either it should be an actual damage or I should have a potential damage. Now, what you may ask is the value of these things from the examples what I have said. Now, there we know that if for 1 minute you have to go back to another video I did that's called as the alignment, and a lot of people were shouting at me from the WhatsApp to Facebook that you have not read, and this is very important and things like that. Think about it like this: if you are not in a proper alignment, is your brain thinking that there is going to be an actual or a potential damage to you? How do you think that if you are not aligned, you are going to have an actual or a potential damage? I'm not going to tell you the answer. You think for yourself, can you actually do that? Right? if it can be done, right, if you're not properly aligned and you can actually produce a damage or a potential damage, are we an evolved apes or we just an useless stick, right? Think about those things also. So I think this definition gives you so much of uh, insights into where you want to go, what you want to understand, and things like that. The next thing I want you to, we want to sort of expand on, because it is a sensory and an emotional experience, right? The definition itself is tell you it's an emotional and a sensory experience. Then by definition, your brain is involved, right? You need a huge amount of things happening in your brain. But most of our thinking, most of our understanding of our pain for the last 20 years, that's what happened when I was in school. So 25 years or something like that. Most of it is about the peripheral reaction, right? So you get a snake bite, you get prostaglandins, cytokines, substance P, all these things are liberated, or they are happening inside your wounded area. That causes a change in your potential, and this travels. So what we are thinking always, okay, I have to remove these chemicals, I have to remove these chemicals, I have to remove these chemicals, then only I will get a pain relief. That's what, and mostly what an NSAID does, right? It tries to reduce these chemicals. So we have always, if you go to any physiotherapy talking or classroom, you will see that they are always talking about increased blood supply and flushing out of this peripheral area rather than modulating your brain or things like that, right? So that are the those are the two parts you want to understand from the definition. The other thing we want to understand is, we all keep on saying that now we think that the pain is a danger signal, right? So what is the value of that? As I told you, when I went to college, that was not how we were taught. I don't know why, but anyway, that's not how I learned it. Even probably before 5 years, hardly anybody said about it being a danger signal and things like that, right? That's where our story of last week also comes in. That is, it's a danger signal, right? You are under danger, you are under attack, you are going, something is going to happen to your hand or to the whole body. This is very important to understand, right? Why? The first thing is, remember, if it is a danger signal, it is not going to adapt. Unlike other sensory information, say for example, you may not be aware that you are wearing a shirt all the time, even though your shirt is touching you all the time, because you are adapted to that senses. If you are wearing a glasses for long time, you may not sort of know that you are wearing a glasses, right? Because you adapt to that. But the pain signal does not. Why? Because it is a danger signal. You can't stop the danger, then how will I give attention to my snake bite, right? How will I give attention to where I have been hit? All these things will not happen. So this is also important. That's why people are keeping on shouting that it's a danger signal, rather than pain. The next thing you want to understand is, the danger signal, whatever is going from your peripheral, from the snake bite, it goes as an electrical impulse. It doesn't go as a danger signal. The brain understands or perceives it as a danger signal, right? We all know that. The brain only can perceive, right? The brain only can say that this is danger. The brain only can say that, that's all right, I can manage that, right? Again, we want to have a understanding of the brain where this is involved and this is involved. But look at all our treatment techniques. It's rubbing your skin, putting a teacup in your crouch or on your skin somewhere, and you think that you are some sort of expert. And then there are also the kitchen boys who come with all sorts of kitchen equipments to rub the patient. Why? Because they have a poor understanding of, or we all have a poor understanding of, just the definition on the word of what is the value of pain as a danger signal, right? So the next thing I'm going to sort of build upon all these things is, because it's a danger signal, right? It has to go to different parts of the brain. Because it's an emotional reaction, it has to go to different parts of the brain, not just your sensory cortex, right? Because we know that from the definition itself that it is not just in your, it is not just sensory information, right? Remember, it has to go to your sensory cortex also, because we have to know where your pain is coming from, right? But it's an emotional experience. It's a danger. So it has to go to a lot of areas in your brain. Again, we need to understand these things. And then only we can have a effective, a far more better treatment plan, right? Right. So this is a sort of a meta-analysis of what are the brain areas which can be activated if you are having a pain, from a lot of fMRI studies and things like that. It's not a new study, it's an old study, but the picture was sort of very clear, so I'm using that. So you can see that when you have a nociception, right, whether it is A delta or C fibers, you get and it goes to your neurons in your spinal cord, and it gets wind up, as we already seen, because it's a danger signal. It has to be amplified, and it goes up, right? When it goes up, it goes to, of course, it all goes to thalamus via the brainstem, and the thalamus relates to different parts of it, right? And one of the important things most of us sort of don't read much about is this part of it, the insula, the putamen, your amygdala, hypothalamus, all these things, right? The amygdala, hypothalamus, the hippocampus, all these things with the insular cortex and things like that form what we call as the limbic system, right? From the limbic system, you will also have projections into your prefrontal cortex, right? It goes to the frontal part of your cortex, that this part of it, right? So the impulse is going here. In the base of the skull, you will have your limbic system, right? Base of your brain, you'll have your limbic system, and the top, it goes to your prefrontal cortex, right? Again, you want to understand what does your limbic system do, right? Limbic system is basically about emotions, your primordial emotions, being fearful, being anxious, right? So about your basic motivations like sexual drive and things like that, right? They are there to protect us, and this is the part of the base of your skull, part of your brain, is basically your lizard brain, right? That is where your reptiles and your mammals have a sort of a larger limbic system and a very, very small cortex, if at all they have a cortex, right? So when the signal goes to your limbic system, there are certain things happening, and it also goes to your frontal cortex, certain things are happening. Right, we are not going into a lot of details today because I'm going to do those things probably in the next video. I'm going to talk about only one thing today, right? That is, because it's a danger signal, right? We know that it's the pain is a danger signal. Anybody who had a zoology lesson, right? Most of my 12th classmates all studied zoology or botany. So if you have any sort of understanding of an animal, right? If it is in danger, it can only do two things, right? I will count until 5 so that you can come up with an answer, right? 1, 2, 3, 4, 5, right? That's right. What you have said is correct. That is, it can either fight or flight, right? It can either run away from that or it can actually fight, right? So this is where our understanding of the pain has to come, right? So if it is fight response, right? If it is saying that, okay, it's a pain, I'm going to fight it, what will be the neuroendocrine system? What are the systems which are active? Okay, I'm frightened, right? That's what happened in the story of the snake bite, right? What did she do? What will she do? What will the person who has a snake bite will do if he is frightened, right? They will go harder. You will have activation of the cortisols, that is your stress hormones, right? You will have activation of your PAG, that is your uh, aqueductal gray matter, which in sense releases your fright response, right? You will also have reactions like increased heart rate, increase in breathing response, you're sweating more, all sorts of things, right? So you get a whole range of response if you have a pain. And most of the time, we are always talking about this muscle is tight, that muscle is tight. Now, you again ask me, what is the value of understanding all these things, right? You know that we are having a lot of people who are going into chronic pain, right? These chronic pain people have anxiety, these people have depression, these people have all sorts of psychological issues and pain. They are unable to reduce their pain, right? So when we have a limited scope of looking at it, rather than seeing it as a sort of a bodily function or a function of your whole system rather than as a musculoskeletal issue where I will keep on scrapping it. And there's another group of idiots who think that you can change the fascia. And in this physiology, how did the fascia get tighter in a single day? I don't know what these idiots are thinking, but anyway, that's all. Will not go into those things, right? So this flight or fright reaction, if you're always facing pain, if you're always in pain, your fright or fight response becomes larger and larger, right? Especially your fright response, because your pain is always there. If you see, you can also see that just a minute, you can also see that there is also some amount of activation of your here. It's not in this picture, I think it's in this picture. You will also have activation of your reticular system, that is reticular activating system. So these systems are for your sleep, right, or your awakening, these kind of functioning. So that's where you have people who are having a poor sleep, right? So all these understandings come from just understanding two words. That is, this is pain is a danger signal. The next one is it is a sensory and emotional reaction. We will also look into a lot of emotional reaction. That's what I was talking about, the primal, motor cortex. I mean, sorry, free frontal cortex, right? They are involved in your cognitive ability, right? To make decisions, to make motivations which are based on our understanding rather than primordial motivation which comes from the limbic system. So these kind of things come from your processing happening in your prefrontal cortex, right? So if you have an understanding of as a whole, then only we will be a better professionals in reducing pain, right? So so as a summary, what I would suggest is read the definition properly and try to find out what is the value of seeing it as a danger signal rather than just as a pain as uh, sort of a sensory information, right? In the next video, I'm going to talk about the limbic system in detail and your descending tracks, right? How the pain is reduced. Remember, you can't adapt the pain signal; you can only reduce pain, right? So in the next video, we will see about that. right? Thank you for listening to our video. And if you have still not yet subscribed, very, very bad. Subscribe fast, right? Thank you and have a wonderful weekend. Bye.